Please watch this and pass it on, because this will not only have a potentially devastating effect on millions of lives, but could very likely affect your life too if it is not properly managed. Covid-19 has sent countless countries into lockdown, with many of the top healthcare systems in the world struggling to cope and seeing large amounts of people dying, and tens of thousands of people being affected by the losses, not to mention the economic devastation that will be suffered by many. Most Western and Asian countries are quite far down the road in terms of infections, and many are starting to see the flattening of the curve after weeks of quarantine, building new hospitals, and ramping up production of medical equipment. And some may soon see the lifting of restrictions, opening of borders, and a return to some sort of normal interaction with other people. But with all our focus on ourselves and our own countries, we have neglected a looming catastrophe building in Africa. One which will not only affect millions of Africans, but also directly impact those in countries that are just coming out of quarantine. You and your family and friends. You see, the continent of Africa is just at the start of the coronavirus crisis. Infections are still low, but growing. And Africa's spread is where Asia and Europe were about 2 months ago. It is easy to assume that Africa is lucky with a low infection rate. But remember when we thought the same thing about Europe, USA, and so many other countries months ago. But here comes the crunch. The well-developed healthcare systems of Europe, Asia, and North America are barely holding it together. But luckily they are managing. It's been a difficult fight, but they are slowly winning it. There are 54 countries in Africa, and nearly all of them, with a few exceptions, have no healthcare systems to speak of. Their governments do not have the ability, or in many cases the will, to lock down their countries. They will not be able to stop the spread, and they do not have the health facilities to cope with the spread when it comes. While Western countries are building tens of thousands of new ventilators to add to their existing stock, the Central African Republic, for example, has only 3 ventilators in the entire country. If you want to find out more, then please see the articles on this website. Africa is not able to manage or cope with a virus when it does take hold, which it will. When it finally reaches the critical mass that it did in Europe and North America a few weeks ago, it will explode. It will explode like nothing we have seen on other continents, and with no means to stop it. And this will happen at just the time when Asia and the Western countries start relaxing our restrictions and our borders. Just as we start coming out of quarantine, countries in Africa will be blowing up with a virus. And that explosion is going to ricochet right back to the rest of the world. Infections will stream out of Africa, knowingly or unknowingly, and can easily reinfect the rest of the world, putting the planet right back to where it started. At this stage, we have maybe an 18-month wait until a vaccine is found, so we have to step in to stop this outcome. We have been so busy worrying about our own countries, we haven't even noticed that during the scramble for scarce medical resources, Africa is being blocked from receiving any, because there is no money to pay for them. There's no testing, no quarantine, and no healthcare facilities in most countries. We won't even know how many people even have it in Africa because most countries are not testing. Because they cannot. So we will never know the true numbers. But millions of people will die, and your country could also be reinfected. The only way we can prevent this is to support the organizations on the ground that are able to make a difference across the continent. There are hundreds of organizations across Africa able to step in and take over where governments cannot. They can provide healthcare, food, support, and quarantine facilities, but they cannot do it without our support. They are running dry, They need more staff, more facilities, more equipment, and for this they need money. They need a huge amount of money. We are aiming to raise as much money as possible to support the hundreds of organizations across Africa during this time. These could be charitable organizations, local government bodies, food banks, hospitals, shelters, or any other facility or person that is able to help stop the spread of COVID-19, to care for those that are infected, and to support the millions of families who will suffer hunger and malnutrition from the economic collapse. And also, of course, in doing so, stop the reinfection of the countries that are coming out of quarantine. We are all realizing for the first time that we are a global people, and that the events in one part of the world do have a direct effect on ourselves. Please give what you can and prevent COVID-19's biggest possible catastrophe from occurring. If you cannot donate money, then please pass this on as far and wide as possible. We need to stand together now, more than ever in our generation. We thank you for your support. We thank you for your generosity, and we thank you for your compassion.